Hi, I'm Dr. Bak, presenter for MDEX & Co. This is a new social and economic pact for the dental industry. My industry faces many challenges. In this time of crisis, the challenges has risen all at once, and now we can't ignore them anymore. Everything is too clear, everything is painful, and they all need to be addressed right away. The COVID crisis has put everything on pause. As dentists, we were the first one who has to respond to that pause. The emergency is barely to the minimum. It's about 5%, even less of our care. So many have been shut down for more or less 3 or 4 weeks now. This has brought to my attention all the challenges that my profession faces. I try to comfort my team. I try to fight for them, to give them some resources. Then I try to fight for my peers, working with the associations and with the organization in place. Well, we understood that we were left aside. And on top of it, we don't have the sympathy of the population. In this unique time of crisis, we had an article coming out explaining our position and explaining also that we have been left with nothing. And the population raised their voice against us. This is why when I'm talking to my colleagues and myself, we have personal testimonial of patients saying, how are you guys doing? You need help. On a day-to-day basis, I think that we are appreciated by the people that we treat. But in a broader sense, I don't think that the population likes dentists that much. And this is a huge PR problem. What we see, the governments started to. We lost our voice and our leverage. To be honest, the dental industry has been an independent word until lately, especially in Canada. It's hard for our small team to rise up to make a difference. At this stage, we need something wider, something bolder to raise up. We have to listen to the population. Well, they're saying that we've been too expensive for too long. What they don't get, it's we have many a hospital to run. It's all coming back to the fact that we have too much infrastructure on the ground. And by the time that this crisis will unpause, all this infrastructure will have to be upgraded all at once to now face a new standard post-COVID. Who's going to pay for it? So when you think of it, dental fees will be even more expensive. That doesn't make sense. Nobody will be happy about it. So that's coming back to the fact that we have to learn to come as an industry and start sharing resources. Not just get more to debt, have our own resource, and operate them about a quarter of the time. So this crisis brought to my attention that what we're doing here is not just commerce. It's not just try to gain market share. It's a way to reform an industry in crisis and that faces more than one challenge. We need leadership, we need vision, and also we need the will to make a difference. Hi everyone, welcome back to the office. It's been a while. It's been 2 months and we all survived until now. COVID has caused a lot of trouble to the world. And as promised, we'll be sharing with you, with our colleagues around the world, what is the situation, what we learn, and what's ahead. Without further ado, I would like to welcome all my Alpha colleagues here. So from that person on my screen, so there's no preference here, I have Dr. Julio Reynafarje, who will be standing for Peru. Dr. Pavel Krastev, standing for United States, New York. Dr. Lam-Do will be standing for Canada, Quebec. Dr. Preetinder Singh will be standing for India. I'm sorry, I don't know the state of where you're from. Dr. Pulver will be standing for United States, for the state of Illinois. Dr. Lina Dusevičiūtė will be standing for Louisiana. Dr. Ouellette will be standing for Florida and Georgia. Dr. Kundstater will be standing for Missouri, and Dr. Dominique will be standing for Georgia, but right now he's traveling around the world. To all my friends, thank you so much for taking the time to be with us. And without further ado, let's start. My first question to all of you is, how's it been going? Dr. Reynafarje, would you like to start?
Very much for the invitation. And right now we are reassuming our duties over here in Peru. Many of the doctors right here are doing the same. And what we found is that many things have changed since this pandemic starts. So the relationship between the doctor to doctor way that we are trying to do and the way we are relating to each other has become and make a real change, because we are caring for each other and we are trying to reach our patients with much better protocols. And we have it's little bit more concern about the patients and the patient's health, and how we can relate also to doctors, to medical doctors. So the idea is to make it's like unite a little bit more, and that's the way we are all looking at this pandemic right now here in Peru. And
but how is it in Peru? Are you still in confinement?
sorry?
How is it in Peru? Are you still in confinement?
Yeah, no, not yet. Today we are in confinement. Only the Sundays we have confinement. But every day you can go to work from Monday to Saturday, and not only till 11 p.m. So 11 p.m. to 5 a.m. you have to be at home by the government. The government said that. So that we are having is it's partial confinement. So the idea is, but we have many problems because Peru was very high in the rates of the way that disease has developed right here in Peru. So right now the numbers are falling a little bit apart. So what we are trying is to still keep the confinement and keep all that we can and all the measures that we need to have protect to all of us and our patients also.
Thank you, Julio. If we're moving now to the United States, the state of New York, Dr. Krastev, if you'd like to give us an update of your situation.
New York got hit very hard. We got decimated here. We had probably some of the worst numbers across the country. Now we have several hotspots in Brooklyn and several hotspots in the city that are being restricted, I guess. But we're back to work. It's difficult. Patients react with the same anxiety that I think we react as clinicians. It's a little bit of a different world that we're all doing our best to adjust. But one thing I must say is, throughout this crisis, we came together, and I salute all colleagues, all healthcare professionals, that everyone came together, and I didn't hear too many people complaining. So I think as a profession as a whole, we did very well in considering the circumstances. And then, of course, continuing education changed, life changed, dentistry changed. And I want to express special thanks to Dr. Keanu Shah and Global Summits for pivoting so quickly and responding and essentially bringing continuing education and doctors together across the globe and other healthcare professionals. And, it makes the pain that much easier. Having said that, in New York, my brother-in-law is a critical care pulmonologist, and I spoke with him yesterday. And he's saying that the numbers in Brooklyn, where he practices in the hospital, are starting to jump up again. Not ridiculously, but they are climbing up again. And for a while, it was quiet. The other thing that I want to mention, we have to really address our younger colleagues out there. You guys have to be strong. You have to be open to learning, to joining people like ourselves who believe in teamwork, who believe in joining all colleagues across the globe together so we can be stronger in dentistry, so we can be united, and so that we can essentially share the pain of what this dynamic monster called the COVID-19 is doing to the world. And I want to touch up on this point. And I like to talk about this in the different lectures I've done and partenars and seminars. But here's the point. COVID is a situation that is dynamic. It is changing every day. It's not a static event that occurs or occurred yesterday, and we can all sort of move on and heal, as Dr. Bach likes to say, to heal from the event and move forward. So it's extremely difficult. I think we're doing our best. I think we have to be positive. We have to focus on, again, joining our hands together, doing the right thing to protect ourselves and each other and our colleagues and our patients. And having said that, I'm going to kind of leave it in this note that, I notice in my practice, we're running at about 50% capacity. Why? First of all, I have a small practice, so we never really run on high capacity, but now we're doing half of that. So why? We need to sanitize each room before every patient, with UV lights running, with this, with that. We're using standard precautions on steroids. All right, so this is what's going on. Some patients are very understanding. Have we had problems with particular patients that get upset at the fact that we are taking extra precautions and they feel like they're being singled out? Yes, we've had that problem occur several times, and we assure our patients that really whatever we're doing as healthcare providers, we're doing it in their best interest. So it's a difficult time for all of us, but again, Global Summits and Dr. Bach and all of us together sitting here, we're doing great things together. We're trying to share our knowledge and our friendships and extend them to all of you colleagues out there in the world. So I'm glad to be here and thank you for the invitation.
Thank you, Pavel. Dr. Jeremy Krell will be standing for United States, the state of New Jersey. And he asked not to appear on the screen, but he was from the beginning one of our alpha that's the most contributing. So Dr. Krell, you have the mic.
Yeah, so just in brief, and thank you for having me, because a lot has been said for the US and that stands for New Jersey as well. We are probably seeing about, roughly 70% capacity in dental offices out here, maybe a little less, a little more, depending on the office's, individual culture and normal capacity. US has seen about 210,000, deaths or so already, which is, pretty high compared to the rest of the world, and millions impacted. So you have a lot. Testing is broader, but still not, rolled out or done nearly as well as some other countries are doing it. So these are kind of some of the things that we're struggling with now. I think a couple interesting tidbits. The American Dental Association just published its study done to show that less than 1% of dentists in the United States are actually that they know of are actually contracting COVID themselves. So it does seem like the PPE usage by dentists has been pretty protective. I think that's probably all the buzz this past week in dental media in the US. So I think that's a pretty big.
Let's celebrate this one. It's our first win here.
Well, Jeremy, if you don't mind me interjecting, I think really that's because we, especially in the U.S., since the 80s we have mastered infection control. So it just I saw that same article. Less than 1% of dentists have contracted COVID. And I think, in North America, we've just done an exceptional job with infection control dating back to the HIV epidemic. So sorry to interject, but, I just, we have that tradition there, in the US,
Right. And so that element has been done really well. So I think that's really kind of grounds for celebration for sure. I think another element is, I work a lot on the B2B side of dentistry. So helping, kind of companies with dental products and dental software to reach dentists. That ability to reach dentists has been, kind of something that's waxed and waned throughout the pandemic. Initially when everybody was sort of in chaos, it was impossible to reach anybody. Then there was this explosion of continuing education and webinars, and that provided an avenue to reach folks. And now things have kind of returned to I'll call it a new normal, where I think webinars have tired a little bit. And so we're returning back to some of the recent tactics to reach providers, but we're still not able to gather safely in person, right? Those dental conventions that really comprise a big part of dentistry and the culture among providers in the US are not able to happen in person. They're still virtual, or I think in the beginning of 2021, what we're going to start to see is some of those gatherings start to happen, but outdoors if they can. It's obviously cold, but as the spring and the summer roll around, you might see some more outdoor events that do allow professionals to gather safely, and exchange new ideas. So I think that's what's kind of on the horizon from my perspective. Thanks, Dr. Bach, and everybody.
A special series, The Innovators. From his words, Ron Klein is an ordinary man. But his innovative ideas have changed the world. He is the inventor of the magnetic strip on the credit card validity checking system, and the developer of computerized systems for real estate, MLS, multiple listing services, voice response for the banking industry, and bond quotation and trade information for the New York Stock Exchange. Don't miss its premiere October 31 at 11 a.m. Streaming live on Facebook, LinkedIn, and YouTube. A special series, The Innovators. Welcome to the Alphas.
COVID-19 has left us naked. We have our pants down and we won't prepare. And we're also in an industry that is very conservative. It's very hard to push it further. There's a lot of red tapes, risk management. With this crisis, we have to change our ways, especially dentists. Everything cannot happen in an OR. Not everything, but everything we can't get out of the dentist should get out of the chair. At the light of this crisis, we also know that sometimes it's better to keep a distance from a patient. The solution is obvious. We have to invest heavily into teledentistry, which telemedicine is doing at this stage. We have to make sure that the legal also follows. But this will be, in MDEX way, the means to get the profession cheaper. The population has raised their voice, saying that we're too expensive. We're gonna change all of that. But what we're willing to do as MDEX is to lead the wave of teledentistry and to cut the fees to the minimum. We're gonna be accessible. We're gonna be there to rebuild that trust. We're gonna be there to create that bond that is missing. I'm Dr. Bach, CEO and founder of MDEX. I'll be there to answer all your questions. I'm more than open to discuss our ideas and also improvements upon them. And I will take a few minutes to thank the people who support us, our patients, our staff, and especially our mentors. Those are the people who has brought the experience on board, who has helped us to believe in our own ideas and to push further. I'm Dr. Bach, CEO and founder of MDEX. Hopefully, we'll be partners soon.
Now I'd like to move forward to Canada, to Dr. Do. You'll be speaking for Canada since I am the host. So Dr. Duc, would like to give us an update about the situation where you are?
Thank you, Dr. Bach. And just to follow what Dr. Krell said, definitely that's one thing that we miss. And I'm sure all of you here do miss that, the meetings that we have in person, conventions and whatnot, all of those congresses. It's for our culture, it's been part of what we do. And I guess the transition was especially with global summits and what you guys are doing with the podnars and everything. So that's it adds to it, but nothing really can beat what we used to do, right, in person. I mean, on our part in Canada, there've obviously been resurgence in cases. Here, particularly in Quebec, it's pretty much where we got it the worst in all of Canada. We're still practicing at the office with the same protocols that we had, you know, I mean, back there in June when we kind of reopened, if I might say, you know, seeing regular patients, but very thoroughly screened, you know, I mean, they're screened 3 times, you know, when they take the appointment, 24 hours before, plus when they show up, you know, and we think as dental professionals, we should be really proud of what we're doing with regards to those, you know, disinfection and sterilization protocols. I mean, the patients come in. I've got a friend, his daughter needed to go to the emergency room hospital yesterday, and you should have seen the state of that room that welcomed her. It was a mess, and none of you would accept, you know, a room that would be messy receiving a patient, right? And one thing's for sure is that that's definitely something that we're very, very fond upon, and we're really, you know, doing things that need to be done, you know, standard of care. But those basic steps for some reason have been, you know, somehow missed, but can't blame anybody. I mean, we're obviously comparing 2 different healthcare systems, but still totally unacceptable. And yeah, I mean, we see now we're at the point where Halloween's coming. Don't even know what's going to happen with that. Poor kids. I have a young daughter. She's 7. It's pretty sad for them, you know, looking at them go to school, their mask with a little banana bag that was kind of in the trend 20 years ago. You remember those banana bags that you got there on your belt with the mask, you have hand sanitizer, you know, you look at kids and start to go to school at daycare. But that's what we're facing at this point. And like Dr. Krastev said, I mean, this is a dynamic situation. We'll see what's going on next few weeks, few days even. Governing bodies are doing the best they can to stay on top of that, but it's definitely not an easy task. I mean, looking at what everyone's doing and what's going on in the world, they can only adapt up to a certain point, but everywhere is different, and we can just hope that everybody contributes and does what they need to be done responsibly. So that's a bit where we're at here in Quebec. I mean, I'm glad that we can get practice. I'm glad we have the confidence of the patients, you know, who come in to see us. Obviously, certain people are still adamant and they're afraid to even get their dental care done. But I don't know for you, I've been more busy than ever in the last 3 months. I've never seen so many cases of, you know, jaw joint issues, broken down teeth. It's been really, really hectic. I'm sure, Maria, you've got a lot of consultations in those aspects and trying to triage and see how they can be taken care of. But you know, mostly grateful that, you know, patients who come in, they do believe in us, they have confidence in what we do, and they trust us to be seen safely. So that's a bit it on our part. Thank you, Dr. Back.
Thank you, Dr. Duc. This it's great news and great hope. Now, I'm moving forward with the map. The people appear on my screen. So we're gonna go to India, on the other side of the planet. Professor Preetinder Singh, thank you for being with us, and please enlighten us about your situation over there.
Big hello to all. It's always a pleasure to talk with Dr. Back regarding his good ideas to talk with the globe. Talking of COVID and its impact, I'm not so happy talking about it since, you know, as Pavel and, you know, Dr. Duc and Jeremy just mentioned how we used to meet each other at the conferences. Everything has been put to a stop for a while. We are being virtual, but still, let's come to the positive aspect. We are doing everything virtual. We are not stopping in sharing of our knowledge through our webinars, through various platforms. being dentist, and since we all are here are related to health, we are not away from each other. Right now, I feel that I'm sitting amongst you in a conference, like in a conference, except a cup of coffee together. I can still feel in person. So if we talk of the Delhi scenario, it's like a mini war going all over the world. Mini war in the sense that, yeah, as Duke said, that kids carrying sanitizers, some bags like bandana bags. Yes, we have sanitizers, we have masks. Then yeah, everyone is driving or pedaling or walking with the masks on. It's like a mini war. We are fighting with something. Yeah, there is fear amongst people, which is going away slowly, because people are getting to know how to deal with it. And coming to dental practice, if we say things were bad initially, but now we have started giving treatments with the proper care since past 3 months. And I would again say that I am seeing more patients in these 3 months. I'm seeing a lot of trauma cases in these 3 months. Yes, and very true. I have given 5-6 rehabilitation treatment to patients with TMJ disorders. And the reason is the stress about their jobs. That was the reason they gave me, that we are stressed about when working at home. And, so I was happy to give them a treatment for their TMJ disorders and TMJ related pain. Feel very good about it. And if we like to say, I have won patients' confidence in my clinic. The patients are, seeing the paraphernalia right now, what I'm using in terms of sterilization and disinfection. The patients are getting more and more faith in me. They are not only me. I would say every dentist, every surgeon who is working in a clinic with a lot of added investments in related to sterilization and more disinfection related to COVID, they are getting more attracted to you in terms of treatment. They feel they are safe. They don't feel awkward coming to your clinic. Now they know that before entering the clinic, they have to do this XYZ and follow all the principles to fight this infection. They're really impressed by what we are offering. And if everybody agrees to me, we are working very close to the infected zone. The oral cavity is infected. If we talk of COVID, we are very close to it. It's through transmission of saliva and through transmission of aerosols. We are working very close. So if I initially said it's a mini war, I would say we are great warriors. Nothing to boast of. I feel proud to work and initially I was a bit 3 months back, before starting a treatment, I used to plan how I'm going to deal with this case in terms of sterilization, disinfection, everything. Now it's my daily regime. Now it's my daily, I have to deal with every patient the same. I am very confident. I don't think of COVID that it is coming into my mind and haunting my treatment. Not at all. I'm being brave. I got absorbed. This thing is absorbed in my blood now that I have to work hard. I have to deal with this COVID. We have to build patients' confidence. So, things are getting better. And today's news in India, we have a positive news from the survey we had. Today's survey on National TV, it said COVID is going to go away majorly by February 2021. Still 4 months to go, 5 months to go. I'm really hopeful it goes out globally. That's about it. We'll talk more. Thank you, Dr. Back.
Thank you for the hope and the confidence, Dr. Singh. Now we are moving forward to Dr. Lina Dusevičiūtė, and she's from Lithuania. Dr. Lina, would like to enlighten us on the situation in Lithuania.
First of all, good evening once more to all of you guys. It's my huge pleasure to be here with you. When talking about the COVID situation in Lithuania, right now the situation is getting step by step increasingly worse. Actually, before we were doing quite well in spring, in summer, but right now we have elections, so no one is doing anything in fear of taking some unpopular decisions. So it's a bit difficult to describe. Right now we have around over 250 cases per 100,000 people. So it's much more, because in summer we had probably 2 cases per 100,000 people. So it's getting worse, but I would say that people are getting more and more used to the idea of COVID and are simply allowing themselves to act a bit more free. But even though we are getting more and more cases, the death rate is really, really low. So actually, me myself, I had COVID. I did experience it in the spring, but my experience was rather harsh. In my guess is that simply the virus is getting a bit weaker because as every parasite in nature, its goal is to survive, right? So if the virus would be extremely deadly, the virus itself wouldn't last that long. So it's not useful for the virus to kill everyone. Anyway, I think that the changes are really close in politics dealing with this situation. When having our work in mind, firstly, we had to work with all the extra equipment, and right now we are working as before. Actually, we do use some extra safety. We have more changeable gear on us, and we have air purifiers, but basically we're working pretty normal, in a pretty normal flow. In the summer, we had extremely busy time. We were probably working in, well, not 2 times, but 1.5 times, certainly capacity. We had a lot of work. Right now, things are calming down, and actually people are hoping, or maybe not hoping, but guessing for next lockdown after elections. So they're really careful in starting their treatment because, you know, I will get my impressions taken and then they won't give me my teeth. So they're a bit cautious about this. So yeah, I think that the situation is getting a bit worse, but we are simply managing it better. And when having in mind the general world situation with COVID, I would say that I'm so proud for all of my colleagues around the world, because we are in an extremely uncomfortable and the situation, which is constantly changing. It's very unstable ground. And all the dentists, of course, we had, and some of us still are experiencing loads of stress because of the still changing situation about our work. And we don't know how long we are going to be able to work, whether the situation will change, or is there going to be another lockdown, or will they get sick? And nevertheless, people are still passionately driven to improve their knowledge, to take part in all of the webinars, to do webinars by themselves, to communicate with people, doctors across the world. And because general medics, they're really useful in battling this disease, this virus. So for them, you know, they're really the heroes right now. And we are sort of like, yeah, we are doctors. We would like to help, but only this much what we can do. But still, I think that dentists are coping with this situation really great. And I would like to encourage everyone to stay on this positive ground. And I think that you are doing great in general.
Thank you so much for your resilience and your positivity. I think on that, Dr. Krastev, you have to apologize because our younger colleagues are doing better than we are.
Well, look, statistically speaking and realistically speaking, when we look upon the whole COVID situation, we all, I think, can agree that the older you are and the more of the conditions, medical conditions that you may have, you know, the likelihood of contracting the disease and having sometimes fatal complications is rather serious. The younger that the colleagues are, the younger that, again, my kids, your kids, our kids, the children in America and the world, you know, the younger they are, their immune systems are healthier, and they seem to handle the virus, you know, in an easier manner than some of us older folks. I mean, I speak for myself. The anxiety level when I go to work is tremendous. And here's why. I mean, we all respect social distancing, and we all respect wearing masks, at least I do. It's not, no one is forcing me to do it, no one is telling me what to do, but I think it's the responsible thing to do. But the point is this, how much we follow the general rules of social distancing. When we go to work in our office every day, you know, that rule goes down the tubes because we're following our protocols, but yet we're sitting there with all the vapors. We're sitting there with, you know, literally in each other's faces, and we have no choice. So, you know, we have to look at the whole economy, the whole country, the whole world, and then understand that different professions will carry different risks, even if we do everything right. Unfortunately, us dentists and healthcare professionals, we can't work from home and do our jobs only in the virtual world of computers and cyberspace. Most of us have to actually go to our offices and do what we do for patients. So, having said that, for those that have pivoted from traveling back and forth from work, it's one thing. For those of us who do teledentistry and telemedicine, again, it depends on what do you do. An example, my in-laws are internal medicine doctors. They can do telemedicine a lot better than I can do teledentistry. Why? Because for me, there's nothing, I mean, I can speak to a patient and say, well, take 2 Tylenols, call me in the morning, but until I go in the office and expose the patient and myself and our staff to the risks involved, we have no choice. We now, this is what we have to do. I mean, you cannot be a cardiologist and place stents when someone is having a heart attack via telemedicine. So even though I believe in teledentistry and telemedicine, and it's got huge potential in the future, some professions, we have no choice. We have to go in the trenches and do what we're doing, perhaps increase the risk factors, unfortunately, because we have no other choice. So again, this whole COVID situation, in my opinion, depends on what line of work you do. And we all pitch in to do our best to limit the contagion, to limit the spread. We wear masks, I certainly do. When I go to the store, I wear a mask. I try to still, even with my mask, stay 6 feet away from people. And sometimes people get upset at me and they say, well, why are you looking at me crooked? Because I said, you're sitting right in my ear. I mean, I have a mask, you have a mask. But still, when there's room, when there is the possibility of keeping a little more distance amongst each other for our mutual benefit and the benefit of the countries and the world, you know, let's do it. It's not that difficult. And so we have to unite, we have to be together, and we have to do our best individually to pitch in and to sort of control this this monster that's literally destroying our lives and the futures of our kids and what they're going through. It's difficult times, guys. So you know, yeah, that's my opinion on that.
Thank you, Pavel. With this, let's move forward to one of our youngest colleagues. Paul, Dr. Ouellette, we started this together about 6 months ago, and we weren't sure about the future of our profession. And then we got along, people start to mobilize. I'm hearing a lot of hope here from all around the world, and I'd like to know your take on this. Also, you'll be standing for Florida and Georgia, so please update us about your situation. Dr. Ouellette, you have the floor.
Esteemed colleagues, thank you so much for including me as the youngest panel member here. Now I'm going backwards with the age. I've already reached the summit, and now I'm going to go 50, 49, 48, and so on. But anyways, thank you. I wanted to give you an update on my two boys. So I can tell you about Florida and I can tell you about Georgia. In the Orlando area, my son, Jonathan, is an implant doctor. I went to visit him because I needed a root canal and a crown, the first one I've ever had, a root canal. And so I get into the parking lot of his office and I had a double park. There was no parking in his office. He needed valet parking because everybody was so happy that he opened the office that they were coming in, you know, to get their work done. And so he has continued to be that busy. And Florida might have been one of the earlier states to open up. So that's probably why he was doing so well. My other boy's an orthodontist in Jacksonville, and he's more conservative than Jonathan, so he was very, very careful. He had a positive COVID test, and so then he calls me up and says, well, Dad, would you come cover? Because I've got to, you know, take 2 weeks off. So I went in and covered and got to work for him. And the patients there were so happy to come in. It ended up that he took 3 other tests, and they all were negative. So he had a false positive, but he was very careful, you know, so he wouldn't expose anybody in case he did have it. So everybody in the family was just so worried because you know how the media blows everything up. And so I started reading on what are some of the cures and some of the things that protect us as dentists. And one of the things, when I went through the AIDS era 25, 30 years ago, the same thing, exact thing happened. You couldn't get dentists or patients to come to your office and feel safe. And back then, T cells were the things in the news, you know, how many T cells you have. So some of the articles that I've read is that as dentists in our profession being exposed to all these varmints every day we work, we probably have an immunity just from our T cell level. And not necessarily the antibodies for the COVID. I just had a physical about 3 weeks ago, and the doctor couldn't believe how good my heart was and my blood pressure, 53 bits. My resting was 53. That's almost dead. And so I had a test, and I have not been exposed to it yet. So I don't know if it's the T cells that's fighting it or that little germ, you know, has not hit us yet. But I think we're going to probably come out of this. Q1, we should all be almost back to normal. And I think we are going to see some new delivery methods, which, you know, one I'm working on. And we're going to learn from this, just like we did when the AIDS epidemic, you know, caused exactly the same problem. We came out of that and everybody thrived. And I think that's about it as far as my introductory comments.
Thank you so much for taking the time, Dr. Ouellette, and thank you for the hope you're bringing on board, because you're showing us that we can reinvent ourselves at any age. And for those of you who like to follow us, Dr. Ouellette will be part of a special series called The Innovator. So this is how he decided to respond to this crisis, bringing new technology and mentality on board.
I'm Mr. Back. Welcome to the office. Our profession is broken. Not just talking about dentists, but the medical core is broken. You know that image of a hamster wheel? We have been trained and falsely led to believe that we were more than workers. This is us, always trying to run. Wrap your mind around the fact that your biggest asset is yourself. This is wrong. We are nothing but glorified workers. If we're that good, but just inside of a wheel. Why is it that so many of us finish depressed, suicidal, and even worse? What happened the day you go sick? What happened the day that you just go tired and you don't want to work anymore? By this stage, remember, we're nothing but glorified workers for as long as you're working, you have an income. What happened when you stop working? What happened when you hit retirement? What happened if you just want to have more out of life? So all of those are things you have to think of. And this is why, as doctors, as dentists, we deserve to become millionaires. Not because we're ambitious, but because we're smart people. Because we're looking forward to the future, and because, yes, we've earned it. Don't step on that line. Beyond the rules. You can easily reach for the next step, which is becoming a millionaire. And the whole hope of this course, actually it's not a hope, it's a promise, that we are all halfway there. What I'm trying to do here is to free you from that trap. Not a trap, a trap. You have to be able to deal with the consequences. Make leverage out of each of your liability. That's the best way to move forward. For as long as you still have enough strength to get back at the game, how are you going to react? What are you going to do with it? This is what's going to matter. On things that you think are burden, just either throw them away or leverage over them. If you're a doctor, you've been through the medical or dental training, you are halfway there because you have the work ethic to get to that point. So doctors, know who you are, know what you've done, know in what system you're playing in, know the rules, and put them now in your favor. I'm Dr. Back. Welcome to the office.
A special series, The Innovators. From his words, Ron Klein is an ordinary man. But his innovative ideas have changed the world. He is the inventor of the magnetic strip on the credit card validity checking system, and the developer of computerized systems for real estate, MLS, multiple listing services, voice response for the banking industry, and bond quotation and trade information for the New York Stock Exchange. Don't miss its premiere October 31 at 11 a.m. Streaming live on Facebook, LinkedIn, and YouTube. A special series, The Innovators. Welcome to the Alphas.
Now we're going to move forward to a lady dean that we have among us. I'm so sorry to keep you waiting so long. Dr. Kundstater, standing from Missouri. She'll be updating us about the state of Missouri, but also about about tomorrow, because she's one of the pioneers doing teledentistry. And Dr. Kundstater, could you please enlighten us about your situation and how it is for teledentistry?
Good news is we've been virtual since long before COVID. So we absolutely, when COVID hit, we saw all the patients that couldn't and didn't get into dental offices virtually and actually palliated and educated and triaged them to emergency dental offices that were open if they needed to. So we are seeing the patients that, you know, the surveys show that 15% of the patients are not going to want to go back until there's an immunization, et cetera. So that we're seeing patients that are terrified to go back because of COVID. And so we are really educating patients on what you all are doing in your offices. And we're seeing patients in all 50 states, Puerto Rico, and the U.S. Virgin Islands. And we're going to expand internationally next month with 2 big groups because even the American Dental Association is saying virtually, you know, do virtual care when you can, So our goal at this point is A, to provide those patients with backup with the dentist being able to see them virtually, and B, to train the dental profession on what to do virtually and how to decrease the viral load coming into their office when indeed you could have a virtual consultation with your patient and be able to provide them with help that they needed and triage them to that valuable chair time that you have. You don't want somebody coming in and then saying, yes, you broke your tooth and I need to see you next week for a crown prep. You can do all that on, virtual consults, save, the whole chair time, PPEs, and all the equipment needed to see a patient and do the many procedures virtually. So we're working on providing dentists with the tools, aka the teledentist virtual connections, and the skills on how to change 2020 your offices to be able to do virtual consultations with your patients and keep them at home and keep them out of your office as much as you can, and then use your valuable chair time for the procedures that need the hands-on care that we've been talking about. So it is across the world. So going internationally is very exciting. We're doing the 3Shape conference in Denmark this week, and the innovation side, and doing a presentation. Of course, I want to go to Denmark, but it's going to be Zoom, darn it. But it is, when you talk about dentistry today, and the first time a patient ever sees you, if they're new to your office, you're going to have a shield on, your mask on, your loupes on, your PPEs on, and trying to instill confidence in the patient that you eyeball to eyeball want to take care of them. Whereas if a new patient visit, you could do 10 minutes in the evening with the patients and introduce yourself face to face, like we're having this wonderful dialogue together now, where they could see you and engage personally with you. And isn't it funny that virtual consults are going to be the most personal experience you'll have with your patients? You'll be able to see them and smile, and they'll be able to do the same with you. And our teledentists are saying that patients are far more open and relaxed. Of course, they're not crossing that threshold of a dental office, and tell you what they need to tell you, because you're focused on that patient and not having staff come in and not having disruptions while you're trying to talk to the patient. And there's a complete consultation time where it's you and the patient, and help them resolve what they need to resolve. Plus you can do treatment plans, financial arrangements. Your staff can do the pre-COVID screening before they come into your office. So the 25% of your time that could be done virtually will download all the, decrease the viral load and decrease your expense on PPEs, and be able to actually see somebody, talk to them, smile, and communicate with them on a personal level through your computer. So that's, our goal is to take care of the patients that won't go in and can't get in and aren't going in, and to help dentists understand how they can impact their practices moving forward on a less, on a virtual consultation basis. So we've been busy.
Are you saying that right now the authorities are pushing for dentistry to become digital? This is what you're saying?
Yeah, that use virtual consultations when you can. They're not just saying all dentistry is going to be virtual. That's not practical, as we've already discussed. But when you can do virtual consultations, again, the financial plans, the treatment plan, you could put their x-rays up on the screen, talk to them just like we're talking now, go over your step-by-step, and save in-office time, not bringing the patient in to do those kinds of procedures, consultations, when you can do them virtually. So yeah, they are use virtual when you can to keep patients at home.
And how about the update of your state?
Well, again, I haven't practiced in the state of Missouri for 2 years now, so I'm just talking United States at this point. So Missouri, in terms of generally, we have the most cases ever as of Saturday, and it's not going to get better. And we are trying to help train the dental profession, because there's going to be more lockdowns. It seems to be that we are getting worse. We're not like the other countries that are getting better, but unfortunately we're not. And I think that, the patients and the dental professionals are kind of, unsure of what steps next, but, we can help them with that too. Oh, box frozen.
Thank you, Dr. Kundstater.
Thank you.
So I think that there's hope here. And now we move forward to the state of Illinois with Dr. Eric Pulver. I'm so sorry to keep you waiting. Dr. Pulver, would like to update us about your status in the state of Illinois, and also you've been working on AI, which was one of the solution we're thinking of. How can we upgrade our profession? Would like to update us on that too, please?
Thanks, Buck, and thanks for this forum where we can all share information. And it's nice to get back again now on the like way down the road to talk with the same group of people that we talked about at the beginning. And I'll touch on a few things because, you know, going kind of at the end here, you guys have all shared some great ideas, and I'm like, yeah, that's exactly what I was thinking, and maybe that's why we're all here together. But if I can take us back to the very beginning, we had a lot of uncertainty and a lot of anxiety, and we were trying to figure out in real time, without being able to go historically to look at anything really. We were getting data coming at us quickly as to the impact of COVID-19. And we, as a profession, I think mobilized fairly quickly and went back to relying on our experience with bloodborne diseases and our care with sterile technique, and creating an atmosphere of safety within our offices for our staff and our patients and the communities in which we live. So we had something to fall back on, but we weren't really sure exactly what we needed this time. So today we have more understanding of the situation we're in. We see that some around the world, we've unified to create the potential for vaccines and vaccinations and different ways that we can acutely treat patients so that we understand what the comorbidities are associated with progression of the disease. We understand that the virus can be all over and found in biopsies in a lot of different organs and throughout our bodies. And I think that it's brought to light the long-term effects of COVID, where some people get right through it and are fine, and others will have more chronic illness associated with it. And you know, has it shifted us a little bit in that direction as to what we need to be concerned about? So we still have a lot of questions. So we went from uncertainty and anxiety to more understanding to, if we're going to really analyze it critically, there's a lot of questions that still have to be answered. And I'd have to say that forums like this and others that we've all participated in has brought us together. While governments around the world may not have unified, people did. And it kind of like Twitter allowed that, Zoom has allowed that. And communicating with people at the very beginning in Italy and Spain that were closing down more early than we did, or my colleagues in Canada where I'm from, allowed us to sort of have expectations and implement them maybe sooner than we would have had we left it to the government organizations or organized dentistry. And however, organized dentistry has provided a tremendous amount of information, but speaking individually and connecting individually, I think is a special little golden thread that has woven through all of us. And I think that that's something that I hope we never stop, whether it's COVID or anything else. So it's left us this information with some security and hope of the future. And if I take a critical look at metrics, what is case positivity numbers and how important is that? We believe that, you know, we're just getting around to having enough tests. So of course the numbers are going to be going up. So is that significant? That's a question. You know, are we looking at the right metrics to provide the right information to our communities? In Illinois and Indiana and Wisconsin, we had peak numbers of positivity cases October 16th, but that's not a surprise. At the very beginning when we taught and we knew flu season would be here one day, we knew, well, flu season with the flu and COVID, maybe we're going to have like a perfect storm going on. But we do have a lot more information today to handle that. But should we be looking at case fatality numbers? Maybe we should be. And maybe we should be looking at metrics of emergency department admissions to ICU emissions and the number of beds available geographically in the ICUs. And that can give us a little bit more understanding and information of the direction we have to go in. There's been some great information linking oral health to COVID progression. I think that was on one of the global summit events. Some of this stuff that we're finding out and the importance of oral health with systemic health is really encouraging as well. The 1% number that was recorded by the ADA, what I'm wondering is, that's good. That's good news, right? And we've all created certain safety mechanisms within our office, whatever we want to call them, enhanced patient protection plans, air disinfection. I think globally we're doing the same things, but is this a false sense of security? Is it really, is that what's preventing the numbers from being reduced? I don't know. I like to know. I think we all have to be very careful in what we're doing. I do know our screening questions, for the most part, temperature, have you had a cough, are really insignificant. And really more recent research has shown that only loss of taste and loss of smell are actually directly related to whether someone has COVID or not. So we're doing a lot of screening. Is it really making the impact that we think it is, or is it confirmational bias? Are we looking for things to give us the answers, or is there something else there? So I'm cautiously optimistic of the future. I'm really thrilled with the low numbers because that's a good thing to point to. We're doing a good job. And I look towards the future, and my hope is that rapid, inexpensive testing with sensitivity numbers that are good, less false positive or false negatives, like Paul mentioned with his son. Those things are going on now. And what do we do to keep our practices running safely and also economically viable, where we have people coming in with the flu, or our staff with the flu, or ourselves with the flu, and then we have to get a COVID test, and it takes 4 or 5 days? How do we manage the HR? How do we keep our practices safe and viable? These are questions moving on into the future. And having said all that, I do believe that there's some amazing things that have happened because of COVID, because it's almost like a computer and technology crashing, and then you reboot it. And then you have an option. Do you want to reset to the old, or relapse to the old, or reset with the new normal, or move forward to something different rather? And I think that we have an opportunity to move forward with something new and different. And I think that we, as dentists, are really in a good spot to adapt a virtual workflow, which will build efficiencies. And part of that is, as Bach, you alluded to, with innovation in technology and artificial intelligence, we've been able to really build in quality assurance, reduce contact work time with patients, reduce the amount of time it takes to come up with more accurate diagnostic findings, using AI as a second opinion, a teammate that's on our shoulders that says, hey, look over here, let's check this out. Let's follow trends in early computer vision or radiographic interpretation of decay. We're looking into bone loss and linking oral systemic health links. So as a profession, we can really impact overall health and wellness. So I think that there's a lot of opportunities. And as I said, I'm optimistic about some of the impact COVID has had, so we can create great change as a profession moving forward. And yes, I do think AI and machine learning and collaborating will be a big part of that moving forward. The opportunities are boundless, and it's exciting. So that's a little summary of kind of how I saw things, where I see things now, and hopefully working together, we can continue to create a safe environment and push change and make it happen.
Thank you, Dr. Pulver. I'm sure that we'll have to come back to this, and I'll invite all our colleagues to jump in. But I'd like to move forward to somebody who has waited so long. Dr. Paul Dominique, he will be standing for the state of Georgia, but he has a special status. He has the opportunity to travel, and he also have a foot in Europe. I think you're in Spain right now. So You can update us on both situations and what you see from one state to the next. Dr. Dominique, you have the floor.
Thank everybody here, for showing up and, participating. I think this is a great group that we have going. So I started back with clinical care on May 14th. I was in Atlanta, Georgia at the time. And, that was the day in which, the governor allowed us to resume dental care. And, you actually took a virtual tour of the office I was in. Dr. Bach, you saw it, I'm a pediatric dentist for those of you who are now seeing me, and, our practices are really large. I mean, you saw it was one office, that office I showed you, that was 20,000 square feet. So social distancing is really easy for us, when you have, 25 chairs in an office, you can easily social distance. So we really did not get affected in terms of our numbers, except that we actually got busier because we got a lot of parents, showing up, saying, we don't know, where things are going to go, and we're a little bit worried, that we may lose insurance benefits down the road. So they were just asking us to do as much as dentistry, as we could. So we got really busy to the point that I had to be traveling between Atlanta and Iowa, between Georgia and Iowa, and that's how I really did it all over the summer, just going back and forth. I was probably the busiest I've ever been in my career clinically. And it defied logic, this pandemic was going on. We were not letting parents in the waiting room. They still had to wait in their cars to come see us. But we were just, the numbers were just, through the roof. And again, we have very large offices. So we could accommodate this extra volume very safely. But we were taking all the, required precautions, and everybody had to wear KN95 masks and change them, and, PPE, change your gowns between patients. So, we got up and running, and I think we made up for a lot of lost ground, because of how busy we were, and like I said, I was just going back and forth between Atlanta and Urbandale, Iowa, and it was really, really a busy time, But I just would like to, to kind of digress here a little bit and just kind of piggyback with my good friend Eric Pulver in Chicago. We talked about, COVID is kind of being like a reboot, kind of like a wake-up call. For those of you who don't know, I'm one of the investors with Maria's company, the Teledentist. And, I just think, this is the wake-up call that we in dentistry need, because, really and truly, things were not good even before COVID and I'm talking about general dentistry. We as children's dentists, we're a bit lucky because, parents always want to do what's best for their kids. But really and truly, the state of general dentistry, has been, for lack of a better word, decaying for a while. We have a situation where the United States emergency rooms are billing $2.7 billion. That's what they built in fiscal year 2017 for dental services, well, really for dental triage, when there really are no dentists employed at hospitals except for where there's a residency program, and that's the very minority of hospitals. There's no dental equipment in emergency rooms. So these are basically physicians doing the best they can and billing $2.7 billion a year, when the largest corporate dental company in the world, or DSO as we say in the US, Pacific Dental Services, built something like $1.4 billion that year. So almost double the amount of money that the hospitals, because really and truly we're neglecting as a profession, we're neglecting a lot of patients out there, and part of it is affordability. And if you look at the statistics, and I think it's Mario Vujicic from the ADA, which is compiled. He was an I think he was with the World Bank, and then now he's with the ADA as the chief economist. But he basically said that this decline in adult utilization started back since 1997. And I really feel that we need to change the paradigm. And you and I have talked about this back. We had a few conversations about it. Where we need to get Eric and Maria the money they need to really develop their companies, to grow exponentially and to change the paradigm, because really and truly, tele-dentistry is the future. So I'm in Spain here right now, and I just got new health insurance here in Spain. I'm just sure, I don't know if you can see this on my phone, but I can actually now go on a standard. Now I can actually get this. So this is the app for my health insurance, and I can actually get a dental consult built in to the a tele-dental consult built into the app. And yes, this is in its infancy. I believe Maria said we were going to talk with you're going to talk with 3Shape. But really and truly, this is what we need in dentistry. We need a very accurate way of digitizing the oral cavity and really change the way that dentists recruit patients to really maximize chairside efficiency when they have them in their chair, and ultimately, cut costs for the patients. It's a win-win situation. It's going to cut costs for the dentist, and it's going to cut costs for the patients. And I think this is where we need to go. But we really need to come. Back, you and I, we talked about this extensively about getting the funds to help these calls, to help these these companies really take off exponentially.
That's a lot of hope you're putting on the table here. Are you running for president? So I'd like to move on.
We have to change. We have to change the paradigm, and that's going to cost a lot of money.
I can tell you just the good news is Procter. We're doing a pilot with Procter and Gamble, who have your exact same vision, Paul, and they started this before COVID again to develop consumer advocacy for oral health. And the spearhead of this program said, you guys all know that Crest is the one that started brush your teeth twice a day, because they sold more toothpaste if people brush their teeth twice a day. And that's a pretty in the dental profession in the United States, it's pretty well understood. Crest started your brush your teeth twice a day. And Procter & Gamble's goal is to get people to go to the dentist twice a year. And have a smile advisor, and we're partnered with them to do this project, and their money that they have should be able to get this as a conversation on every purchase of every toothpaste, every toothbrush. We're hoping that, and there's an educational, and that's what you're talking about. People need to dental literacy. They need to understand where to go, what to do, how to do it. And again, right now it's predicted that 180 million people will not see a dentist this year. And that's ridiculous. On the back of the dental profession. We need to change that. And there's not enough of us physically to go out and change that, but virtually we can educate, discuss, help people palliate problems, and reduce the nuisance problems that all dentists that have a practice know they have when people come in and it's like, you didn't need to come in here. Those kinds of things. How many times do you have these patients come back over and over again? You just go, oh. And those are the kinds of things that can be handled virtually as well to keep your valuable chair time. This is exactly what you're talking about, Paul, with productive patient visits.
If I may jump in for a second, guys, one thing that I think we have to bring to the table here is regarding immunity. Once a patient or ourselves is infected with COVID, how long do we have the immunity for? Is it 2 months? Is it 3 months? Is it 4 months? I think that's something that I don't think anybody knows. The other factor that we have to throw into the equation is, let's say that we do have a successful vaccine that arrives, hopefully sooner than later. How long will that vaccine keep us COVID-free? I personally know a few people, and I say a few, who have been infected with COVID 3 times. That's a scary proposition. Okay. The other thing that we have to think about is PPE. We all know, I think, in the profession, in the industry, that PPE costs money. We're incurring expenses. We're incurring the difficulty of purchasing PPE. I mean, I certainly, we have a difficult time at times obtaining gloves, masks, the proper masks. There's so many things on the table that we have to focus on. And I think very importantly, we have to unite regardless of our political differences and do the right thing for the country, for the world, for our colleagues in Europe, for everyone across this globe, because this is a monster that seems to be persisting, and there's a lot of stuff coming forward that is going to affect all of us, our patients, our families, our children, and I don't have all the answers, but there's certain things that we must discuss.
Pavel, I would say that what's interesting is we are seeing people, like you mentioned, that are getting COVID again. There's some question as to whether they ever actually got over it the first time. So some of the data and information that's coming our way, we need to, figure out exactly what it is that we're seeing. And I just read an article where there was some documentation of a totally second, you have to take the virus out and see that the virus has different RNA, and the genomics of the virus to see if it's a new infection or a second one. Immunity has always been an issue. And every year we get a flu shot. I got my flu shot just 2 days ago. My arm's a little sore. I felt like I had the flu yesterday. They asked me if I wanted to get a shingles shot, right? But then I'd have the flu-like symptoms with the temperature, most likely for 2 days, and then I wouldn't be able to go to work. So I said, I'm going to take that risk. I'm not getting it. I'll get it later. But when they first gave that immunity out, it was 1 shot, and now it's 2. So there's a lot of things we don't know yet that we need to figure out moving forward. And Maria, what's interesting and what you're talking about is, if you can go, and one of the biggest issues that we have are patients around the world that don't go to the dentist, don't have access to the dentist, whether it's in developed or developing nations. If we can impact those patients earlier, not just bring clean drinking water, safe drinking water or sanitary things, but allow them to brush their teeth and take care of themselves, the impact on systemic health would be significant. One of the things we've been looking at and thinking of is taking our algorithms and running them over intraoral camera images, and even from cell phones. And if people were to connect with purchasing of toothbrushes into a automated or system to get them into the right track for their oral health care, and we could overlay a quick, rudimentary quick staining, decay, possible cracked teeth or gingival inflammation. There are some programs like that, but our algorithms will work in that area just as they work in 3D images as well. We've been working on risk assessment scores for 3D spaces as well, for some really interesting concepts having to do with implants or periodontal disease or impacted wisdom teeth and things like that. So those are potential collaborative concepts that could make an impact one day all over the world, maybe.
Yeah, would I say something? We have a system that is called a health passport that we are improving in many companies right here in Peru. It's just a questionnaire with many of the symptoms that we have for the people to fill it every time they go to work. And it's very easy to use. You can use it in a mobile phone, and you put all this information. So all the people that goes to work, it's protected by symptoms. If they have any alert in that system, the people goes and they take temperature, they take the blood oxygenation and all that stuff that helps to make a better decision and a diagnostic or a possible diagnostic. So the idea is to send them as soon as possible, but that's the way we are using to protect all the people that we have in our offices also. So every patient that when before they feel or they're gonna make an appointment, they have to make this kind of questionnaire. And after that questionnaire, if they have an alert, we can also tell the patient, maybe you should go to a doctor to take a look at this, or you can set an appointment before they arrive to our office. So there are many ways that we can improve the kind of service that we're doing. Teledentistry, I think is the future for dentistry. It's gonna improve many things. We're gonna have our agenda. We're gonna have many, even the files, your medical files or your dental files. You're gonna have it in the cloud. And also, I've been talking for about maybe last week. I was in a communication with one doctor from Spain, and he has a very nice system. It's like a Google Drive, but with medical information, and the patients has the possibility to bring their files to every place where they go. So things are changing, and this kind of technology is helping us a lot. And I think the future is going to be half and a half. We're going to have to do it by our computers, by our laptops, and half of the job and the other half of the job is going to be in our offices. Help, as Eric said, we are going to be help, and we have a second or an assistant to our job with a computer and AI also.
Thank you so much.
I'm sorry. I think that exactly what you're talking about, Julio, is what we're keen on right now, and Paul demonstrated, is dental medical integration. And, you know, that patient is not a crown, that patient is a patient. And so it's been shown over and over again in research that dental medical integration improves patient outcomes and reduces patient, medical costs. So as Paul's app showed that they had dental on their app with medical, we are actually partnering with a group to bring the physician into the dental office on the teledentist platform. So we will have, there are right now 108 million people this year that will see a physician and not a dentist. And we're going to place the teledentist in the physician's offices. And then there are 28 million people in the United States that will see a dentist and not a physician. So, the ADA has been encouraging people to do, blood sugar levels, and we've always been supposed to do hypertension, blood pressure readings. But what do you do if somebody has unrelenting hypertension? You want to send them out for a referral. Now, with our program, you can connect to a medical doctor while they're in the office, get a consultation. That doctor can help the patient with, reduced hypertension medication, or get them on a diabetes program, so that we are actually bringing MDs into your practice on our system, so that you don't have to send them out for a medical consultation. They can have that right there in your office, and that patient may not go to the doctor anyway if you send them. So integrating medical and dental, we can actually get better total health, which is what dentists need to be promoting in the first place. And that's the perfect segue, is we not only want to be on every medical, but we want medical in with us too, because we are a specialty of medicine, and it's important in total health to have oral health providers, working with the medical team.
A special series, The Innovators. From his words, Ron Klein is an ordinary man. But his innovative ideas have changed the world. He is the inventor of the magnetic strip on the credit card validity checking system, and the developer of computerized systems for real estate, MLS, multiple listing services, voice response for the banking industry, and bond quotation and trade information for the New York Stock Exchange. Don't miss its premiere October 31 at 11 a.m. Streaming live on Facebook, LinkedIn, and YouTube. A special series, The Innovators. Welcome to the Alphas.
So what we are is a chance to keep the independence of this profession. The reason why we can take this drive and lead the change is because, for one, we understand that this is more than just profit. This is a society in rebuild. This has more implication than just taking market share, banking on profit and popularity. This is about creating a root, a deeper root with the organization, a deeper root with the community, and this is also why we have made sure that all our partners will be happy. And between you and I, we're saying that after 10 years, they're free to go. We are that confident that nobody will like to leave Index, unless they have personal reason that they have to move and change country. For people who be changing cities inside of the same country, we are thinking that this can be an easy swap. You swap in your share of Index on one side, and then we swap that back on the other side where you want to practice. It will take you maybe a few months to readjust, but you're not building back from scratch. To all the dentists partnering up with us, you have a partner. It's just like renting a car. Of course, if you just want to cut your contract, you will have some penalties to face, but you're not alone. To the bankers looking at us and the people who are lending in the money, you know that a dentist can have ups and downs. We never know what life will bring. But unless there's another COVID pause like this one, it is very unlikely that the whole industry will just stall. And this is what we are, the foundation of an industry.
That's a lot of progress. That's a lot of progress.
Still have to talk with my hands.
I'm looking at the clock here. We've been talking for about an hour and a half, but there's one important question that on the last summit we raised, and I'd like to spend, if you allow me, 10 minutes as an open floor, everybody to jump in. It's last time we have a colleague, Dr. Agatha Biss, who was very coming forward with the fact that COVID helped her think about her life, her routine, and also what we are putting ourselves through. And some dentists has been questioned the purpose and also the way that they look at our profession. So I'd like to open this question to all of you.
Well, go ahead, Dr. Tan.
How is it as a dentist that you are renewing with a profession? And this is an open floor. Please feel free to jump in. We have about 10 minutes.
Well, if I may start, I think traditionally patients sometimes assume that we only treat a tooth. They don't understand that a tooth is attached to a jaw, and a jaw is attached to your head. And in your head, you have a brain that operates the rest of your body. So traditionally, I think patients, unfortunately, sometimes don't understand that we are a subspecialty of medicine, just as it was mentioned a few minutes ago. And we have to understand the entire system and how it comes together and work together with physicians, which I'm fortunate in my practice. I have two wonderful physicians, my in-laws. So when I have a question or a problem, I have right away an answer. But I think it's a key factor to put everything together. We treat a human being with feelings, with emotions, and especially now when everyone is frustrated and things are very unnerving for all of us to go on with our regular lives every day, we have to unite and use all of our resources to get through this. And the other thing is patients, unfortunately, sometimes don't value us as doctors. They look at us like, you guys are second-class citizens, it's just a tooth. And that bothers me because, our work is so detailed and so focused that can have tremendous negative consequences when things go wrong. So, I think as a profession, I think we deserve a little more respect than we get. And, It's thanks to all of you guys, and you know, we need to educate the public.
I totally agree with you, Pavel.
Finally, finally, you agree with me on something. Wow.
Yeah, I totally agree with you. I do really think that sometimes, but you know, people cannot evaluate something what they cannot truly, you know, understand. Because to, for example, evaluate endodontics properly, right? A person would need to know what criteria he or she needs to look at to value that. Although when we're talking about prosthodontics, everyone can see, is it pretty or not, right? So the same with teeth.
Well, but prosthodontics should be not just only is it pretty, and this is a very good point you bring up, Lina. You know, I salute you for this. Patients very often judge us on only what they see. So patients very often do not understand how is the preparation cut. Is there a shoulder, a bevel? Is it properly cut? Is the chamfer done the right way? Is the soft tissue positioned the right way? You know, patients only care about money, how much, and is it gonna hurt? You know, once in a while, you get a patient who really understands more, and they appreciate your work. But let me finish.
Yes.
But I can tell you that most patients, 99%, I should say 90%, they don't understand the art and science of properly preparing a tooth before it receives a crown. You know, and this is something that education comes into play. We have to educate our patients that there's different types of crowns. There's different types of metals that can be used in a PFM. It's like from here to next week. But it hurts my feelings personally when patients don't appreciate how much effort I think we globally as dentists put into our profession, and we pour our hearts and souls into what we do. And sometimes I think we just don't get enough appreciation, I should say, because, you know, look, I'm not like one of these guys that wants fame and glory. You know what? It doesn't do it for me. But, you know, a simple thank you, a simple understanding of what we do is, I think, a key factor. Go ahead, please.
I just wanted to add that exactly here what our colleague from the teledentist said, that education is actually a huge part of our work, and exactly how patients should evaluate if they don't know what criteria or what does it take or how can they choose. But coming back to the Dr. Back's topic, it's just a notice or just a thought that I had. When dentists got shut down and our hands, you know, were tied, we no longer were able to do our work, and more often than not, a person describes himself or herself through what he or she does in the world. So when our profession or how we express ourselves or how we realize ourselves in the world, that door was simply shut, all the dentists were like, oh my God, who am I? And but I'm a dentist, I need to keep being a dentist or keep performing as a dentist. And then suddenly we all wanted to reconfirm our identity, and that's when this huge wave of education through webinars came. And I also see that as a huge benefit, actually, because that did encourage us to, first of all, look at ourselves, who are we besides being dentists? Then second of all, starting to appreciate and love this identity of being a dentist. And third of all, it encouraged us to grow and connect.
Well, I totally agree with you. You know, I've been trying to find my identity for 52 years, and I'm still trying to find myself. And luckily, I met Global Summits, Keanu, Shah, Dr. Bach, you know, all of you guys out here who are having this discussion. You know, it's all about connecting, sharing, and being together. So, yeah, I salute you on that, yeah.
No, I'll go ahead, Preetinder.
Okay, that's fine. just wanted to add to Lina's and Pavel's points that, okay, referring as dentist, optometrist, pharmacist, gastroenterologist, cardiologist, these are just the words given to us, but we come under a general category of physician. We are oral physicians, my friends. We are dental physicians. So it's the word dentist is not different from a doctor. We are a doctor, and since I'm dealing a lot with periodontal medicine, I'm also an editor-in-chief of a journal of periodontal medicine. I would tell you, my friends, our oral cavity is a mirror of the human body. We are dealing with every part of human body through the mouth. So if we don't get any words of appreciation, don't be disheartened, because you have done your work. You get the words of appreciation from your within, that you have cured somebody of a dental decay, which can actually lead to a cardiovascular disease someday. Don't worry for that appreciation, my friends. I have heard people coming out of patients coming out of the general surgeon's chamber or the operation theater. Once they gain their consciousness, they still say bad things about doctors. Don't think that they, okay, I'm not counting everyone. I would agree with Dr. Maria. Education plays a role. Even if we are dealing with a beggar on the road, I would say education plays a role. You can be very polite to a beggar as well. So nothing to be disheartened or demanding respect. We as a profession are full of respect to watch to see concisely in an oral cavity, identifying the sign of diabetes mellitus sometimes, identifying many disorders, oral cancers, or anything, foul smell, halitosis. Man, you are a physician.
I think one big one that we identify is hypertension. I mean, I can't tell you how many times in my practice I have patients who come in and they want to have dental work done, and we check their blood pressure routinely, and all of a sudden we get numbers that are astronomical. Now, there's always, of course, when you go to the dentist, there's the white coat syndrome. You get paranoid, you get scared, and but that's why you have to know a patient's baseline level of their blood pressure.
Very true.
If you get a perfectly healthy patient who doesn't really have the malignant hypertension, they go to the dentist, they have hypertension. So we have to be careful and work together with the physicians to understand, do we go ahead with the procedure or do we abort? Because when I see crazy numbers in my office, I cancel surgeries. I'm a little paranoid because I don't want to hurt someone. And that's the way I think we have to focus on patient care. We have to focus on patient education. We have to be sure that all of our patients understand what we're doing, what we're about to do, what we did, what we didn't do, what could happen, might happen, would happen, can happen. Then we sleep better at night.
So, yeah, you're right, Pavel. So when we refer to a physician or we have a talk with the physician regarding our patient, that is an appreciation itself. Since we know what can go wrong, that's why we are talking to the physician. And as Lina said about the appreciation and the physician's role, you're very right. But to reach to the physician, as a tele-dentist Maria is doing to connect with the physicians, because she knows when to connect. So my friends, we are physicians, and every physician has an important role, starting from the mouth to anywhere in the body. So I think it's everyone's role. Let's respect, and appreciation is only achieved by the educated ones, those who know what we are doing. I don't respect from anybody. I respect from everybody. Who gives, it's fine. Who doesn't give, it's fine. At the end of the day, I should be satisfied.
Well said. I want to share a bit of perspective from my standpoint, is that as an oral surgeon, I've lived in the space between dentistry and medicine. And I think that when you first said, what's the question, how have you kind of reconnected within dentistry, and how has COVID changed that? I kind of feel like COVID's taken away a curtain, like the COVID curtain, and it's pushed us into looking both within ourselves and our profession and and allowed us to have a glimpse at the future. And when Lina, when you talked about parameters, it kind of rang a bell in my head, because we all learned certain parameters in dental school that we're supposed to follow. But when Pavel, you said, well, people only care about, well, does it hurt me or the cost? Our profession doesn't have standardizations or calibration or clarity on how to evaluate the care that's being delivered. Whereas you can get cardiothoracic surgery done, and you can look at statistics and metrics from hospitals and make unbiased decisions as to where you want to go. Now, of course, there's errors and oversights made in hospitals. We've all been there. We've had family members or patients where tests haven't been done right. There are issues. However, in dentistry, we need to create something that helps us to implement and standardize those parameters, so we have more unified care, uniformed care across the board, and we have varying levels of the way that care is provided within our communities, our countries around the world. And it's going to be up to us to raise that level up. And I think that overall health and wellness has taken a forefront role in where we need to be as dentists. And it's something that I've personally tried to promote that. And I've been in situations at the University of Chicago where I ran the oral surgery program for 10 years. People don't always want to listen. I would get, a heart lung transplant patient. I call like, hey, we're in the operating room, but they have bad teeth because they didn't look. And can we fit them in right now? And they'd run down and I do my work, or but those things don't have to happen. But it's an issue where we have too much information flying at us too frequently, too quickly for us to break down. We need to have alerts. And that's where I feel technology, innovation, machine learning, AI can create those links between different EMRs and interoperability issues where we have Epic, or in medical, we have different practice management software systems in dental. We need to share the information so it's real time and it helps us to provide better care to our patients. But we need to be uniform. It can't be different. And if we look at an X-ray, we all might see different things. And there's no doubt that the oral biome impacts the gut biome. And you look at all the work that's been done with the gut biome, if you don't eat properly, you're not going to be healthy. And that has an impact in systemic health and medical insurance everywhere. If you're missing teeth, you can't chew your food. So we have companies out there doing work with intraoral wearables to monitor pH. We can do salivary biopsies of the saliva, where there's been consortiums that have put together precancerous oral cancer diagnosis. We have all kinds of different things. We can look at saliva as a new blood chemistry. We can look at intraoral pictures and analyze them. We need to push that forward. We need to do that now. And we know that there's a lot of association, but we need to show the proof between oral links and systemic health. And we need to collect the data, and we have to be diligent about it. We need to work together. So I think that having that message more uniformly around the world with a bunch of people that can make it happen gives us an opportunity to create that change. It's beyond what I can do individually or each of us can do by taking care of our patients in the chair. We can make a global impact with a little local change, right? And I think that that's what's exciting about what happened with COVID, and being able to talk to each of you and who the people are that you speak to. So it's about making that happen and not letting it go, seizing the moment and creating some type of incentive for excellence within our profession. That raises the bar of who we are and what we do as a profession and individuals, and have it recognized amongst our patients and the medical healthcare providers. And that, other than that, I got not much else to do.
Eric, Dr. Beck, if you allow me 1 minute.
Please.
Eric, very wonderful points you added. I would like to take an opportunity to ask, why can't we do this? Why can't we all just, Dr. Beck, why can't we form a team and do what Eric and mentioned? It's wonderful. Let's, Maria, if you agree, we can make a team and let's raise this issue, and we can be the forefront. Why not?
I'm on board for that. I've spoken to a few people already about trying to put together a virtual summit, including learning, AI, oral systemic health links, and inviting people in the medical side, the government side, together beyond dentistry, to sort of say, hey, let's kick this off and make it happen.
Eric, let's make it globally. Let's make it globally. And since I shared, I never knew what you were doing. I am in.
I have said the ADA has just not, organized dentistry hasn't pushed this agenda where it needs to go, and now you just did. So I 100% am in. Again, the research on medical dental integration is staggering that we have not just done a sea change and corrected all of our medical and our dental procedures, but we haven't, but let's do it. I agree. High five, I'm in.
A multi
Eric, you can have our data from Dr. Beck, and we are all in, please.
Absolutely.
Well, I think that sometimes we in life do things out of frustration, right? Because we just need something to push us along to do it. And the randomness of COVID, and then Paul introducing me to Bach, and then Bach and to Julio and Pavel and everyone on this call, and it's pretty interesting. I mean, there's got to be a reason that we're all doing this, right?
Yeah, and Bach is always a good platform for new ideas. I don't know why.
Just to put things in perspective, it is 11:30 in India. Look at the enthusiasm you have.
I never saw the watch, but Bach starts with one topic and we get another 10 topics in a row.
Preetinder, it's Bach's his good looks, man. Come on.
I just wanted to add that how, as Preetinder started and then Pavel actually developed it further, about the criteria, and not only, because I think that this is also about how we as dentists are viewed globally by society, by people, right? And this is a very, you cannot really separate these things. When we have the criteria, right, then we actually, what I just wanted to say, that not politics, not media, not anyone else, but we ourselves are forming our image, our view, how people see us. Are dentists not real doctors? No, we are. And just as seriously we take it, and we translate it, and we inform people, and we show that we are, then we are perceived this way. And yeah.
Dr. Ouellette, you've been quiet, and that is usually not you being that quiet.
Well, it's getting close to the time I got to get back to the nursing home. You all know that. But this has been enlightening today. I just really am so blessed to be a part of this group. And I learned so much from you. And Maria, we got to get together, because I'm ready to go virtual with one toe in the ocean on my phone.
We are completely mobile, and imagine being able to bring all this together on your phone. I mean, that's the phone is the new healthcare tool for this decade, without a doubt. I mean, telehealth is booming, teledentistry is booming, and to be able to provide those all on with the patient needs at the tip of their fingers, what the doctors need at the tip of their fingers, us included in the doctor division, means that we can move this agenda forward and make a better and we can be the driving force. I mean, why shouldn't dentists be the driving force of bringing medical and dental together and improving patient outcomes?
Yes, that's what I was heading
Exactly.
for, Maria. Yes, we
Exactly.
can, and we can do it. Dr. Back, please arrange another platform for us.
Put him to work.
Yeah, yeah.
Dr. Julio, you're smiling a lot. You have I think you have a lot of ideas to add to this.
Yeah, I totally agree with everyone over here, because what we need to do is I have something to add, and that is that last week I was listening to Simon Sinek. I don't know if many of you know him, but he's a great man, and he's a great. He works a lot with the human part, and he was saying, if you have to do to have a startup, where you're gonna deal, what you wanna make a startup of, and that startup, he says, I wanted to do something human, something that links us all together, and we need to use many kind of tools to make us together. And let's see some very easy exercise. When you are working, do you know how many dentists you have around you? Do you try to reach them if they have the same specialty? What do you have? Do you have too many doctors? Do you have many hospitals? You have many things that were all linked to medicine, and they're all linked to health. And we need to know about that. First of all, you have to have a reference in the place where you're living. Then you have to have a reference for what the skills that you need to make your service a better service. And then you have to use to link, you need to link the technology that you have in hand and the technology you can give to bring that to your patients. We have to center in the patient, and that's the way we're gonna make our service more human and more rich, and reach more and more people. That's the idea that I have. So I think the idea from Maria and Eric, and I think we can make a very good match with all these kind of technologies and all these kind of ideas to make a better service to our patients.
Dr. Duc, I would like to ask you to close this conversation, because it's amazing where we went from having a problem to finding an opportunity to build bridges. Mr. Duc?
You're always putting that on me for some reason. I don't know why. I really enjoy it, but I've been listening to you guys closing, and it warms my heart to hear what everyone says, and you know, the love that y'all have for your profession, it just shines through. I'm personally, you know, at the core, at the heart of it, we are clinicians, and you know, I'm a general dentist. I've been a general dentist for 17 years. And, you know, there are many things, obviously, when we're talking about cosmetic dentistry. It's very exciting to have an MODBL filling that fits just perfect with no occlusal adjustment. And you use that endo file to put colors in the grooves. It really looks kind of nice. It's also exciting when you get that endodontic cement puff, showing that you really seal. I mean, how satisfying is that, right? Little things. But at the end of the day, as you all brought it up with the dental medical connection, I mean, it is something that we do know as clinicians, that, you know, whole body dentistry is, you know, the mouth just talks to us. You know, when you open your mouth, there's so many things that can be brought, can be screened, you know, from that. Not everybody is aware that we help with, you know, with breathing, something like that, you know, sleep apnea, things are that one of the things that we focus at the office, you know, it's all interconnected. Tongue posture, rest posture, all of the fascia, it's all interconnected somehow. And one of the opportunity that we took during this period, and our side, with teledentistry, is taking the opportunity to educate patients. And we get those comments that, they're real appreciative of that, being able to take that time, whether it's to show them a full treatment plan, but that's, outside of clinical hours that you can do that. And, like Dr. Kundstater said, they finally get to see your face, which is not a bad thing. And you can deliver so many on a virtual platform. I mean, we on our side, we use it, yes, to have certain patients that need care, that don't necessarily have access, but also, the education part is very much taking over, much more than having patients, for the office. So, why not take this as an opportunity to really connect everything and, setting ourselves apart, because at the end we're all there to serve. And, it's like Dr. Krastev said, just a thank you, and, really feeling that the patient is really appreciative. That's what makes your day, even though we're working all crazy hours like we never did. But, you have to take it, the glass half full. And so it's going to be worth it for the long run.
I am speechless. If there's one thing that I see that COVID has brought is passion into people. I'm going to just summarize through everything that I heard today, but we've been busy. COVID is dynamic, but so are we. We are looking for human contact. I think that now more than ever, even with all the restriction, we have established a contact that it's, I think, more resilient than a virus can challenge. One thing that got out, it's dental clinic are safe. We are safe. For the time that we are out there, we are in a red zone all the time, and it is still proven that we are safe. So on that, I'd like to congratulate all our colleagues around the world who has taken the precaution and also has kept the hope up. Because the other thing is our patients are happy. We have been busy, our patients are happy. How often can we say that as dentists, that people are happy going to the dentist? This is what's coming out. I think that the message here is resilience. And Lina mentioned that very concretely. It's now more than ever, we have to believe in what we are. We have to stand up for our belief. And this wasn't planned, but if the COVID curtain is raised, this is an opportunity for us to unify dental and medicine together. So my message is to all of you at home that listen to this. If this talks to you, you'd like to be part of this, we need you to keep the dialogue going, to keep the change flowing. Reach out to any of us. We're on a social network, write to us. And I'm gonna thank you, all and each one of you. This morning I had an interview and said that me and my alphas, you're not my alphas, you are alphas. I am privileged to have this privilege to exchange with you. I know that we are so many on the line, we didn't have much time to talk. It's been more than 2 hours and we still want to talk. Let's do this more often. And at home, please, if you want this to keep going on, pitch in, write to us, be part of the change that you like to see. And we are dynamic. We're gonna beat this all together. With this being said, thank you everyone. I'm Dr. Back, welcome to the office.
Thank you so
great.
much.
Thank you very much for being a part.
Thank you, guys.
Yeah, see you all again.
Time always flies so fast.
We'll
Yeah.
connect.
Some of you guys have to go to bed, right?
Good to see you all.
Getting late, huh?
I'm living right here and now, and I don't wanna miss out. Is this what life's all about? The world is calling and I'm listening. Yeah, I'm listening. I feel the freedom inside. Come on, let's go for a ride. I finally opened my eyes. what it takes. Sometimes we make our mistakes, and now the journey awaits. So don't you wanna come with me? Come with me. We'll make our way to the top. We'll never break, never stop. And when we get to the spot, we'll know we made it there together. We'll remember forever that life is but a dream. And isn't it amazing? Oh, life can be amazing. Oh, I feel my heartbeat racing. I'll fly soaring ever higher. I can light my inner fire, and then we'll see what happens now. What happens now? And then we'll see what happens now. What happens now? Watch what happens now. It's amazing, oh, it's amazing. It's amazing, it's amazing. It's amazing, it's amazing. Whoa, it's amazing, oh, it's amazing. It's amazing, it's amazing. It's amazing, it's Watch what happens now.